Hi guys.
Hi, welcome back to the Midwife Reality Show.ke. Back to the studio.
We're back.
Yeah. How have you been, guys?
My name is Evelyn.
I'm Mary Guru.
Yes. Thank you so much for your support. You know it has taken a while. We've
Yeah,
not
we had-
posted, but we really apologize. But we are back. We never left.
Yeah, we never left
Yeah,
completely.
we never left. We're here.
Just call of duty here and
Yeah,
there.
yeah.
Now we are back to the studio.
Yeah. So welcome.
Karibuni sana.
So for those who have not subscribed, please subscribe, share, and
Leave a comment.
leave a comment. For the returning subscribers, we thank you. May God bless you. Yes, be part of the family.
Thank you so much.
Yeah.
Yeah.
So, Mary,
And
what
not
are we doing
forgetting-
today? Baby Nana is part of this family, of course.
Baby Nana. Our baby. I know you guys, you must have missed this baby. Right?
Yeah.
Yeah, say hi to our viewers.
You are saying hi
Viewers. Say hi to baby.
to baby. Yeah.
So we are back.
Yeah.
Today we are going to tackle
An interesting
a
topic.
very interesting topic.
Yeah.
Pain management in labor. Yeah.
Pain management in labor. So, labor must be very painful. Not must, is painful.
Yeah, I remember from time immemorial,
Yes.
it's a gift that God gave us.
Yeah.
You remember in the book of Genesis,
Yeah.
where Adam and Eve went and sinned,
They disobeyed God.
and we were told women will labor when giving birth,
Yeah. During childbirth.
during childbirth.
Yes.
Yeah, already passing there.
Sorry for the noise.
Okay.
Yeah.
So this pain is from that means like time in memorial. It's like people never used to
To have pain.
during childbirth,
Yeah.
but it came as a
punishment.
punishment.
Yes.
But God never punishes you completely. He
Even
also
if it
gives,
comes as a punishment, the outcome is very sweet.
it's very sweet, and He
Yes.
also gives you a coping mechanism
And the grace to move on.
and grace to move on.
Very
Yes.
true.
So today, as I've said, we are going to handle pain management in labor.
Yeah.
Guys, what do you do in your country? What do you do in your tribe? Because
Yeah.
every tribe, every country
Has its own way of approaching labor,
Yeah.
an own way of managing labor. But today we are doing a standard.
Now we are doing a standard
Yeah.
as most of the tribes, most of the religions, most of the countries do.
Yeah, because we are controlled by one body.
Yeah.
Yeah, the World Health Organization.
Yeah.
Exactly. Yeah, so today we are going to tackle what is really what we can do to labor when the labor is so painful, so that it brings some relief. But remember, some women have gone through labor naturally, or they have gone through labor using the natural way of coping with pain.
So, Evelyn, what you're trying to say
Yeah.
is that you can cope with labor naturally without requiring
Any additive.
any
Yeah.
treatment.
Yeah.
And you cope like most people in our country,
In our setting.
in our setting, that is Kenya.
Yeah, in Africa.
In Africa,
Yeah.
most mothers here cope with labor naturally.
Yeah.
Okay.
Why would you think that in Africa people need to show that I can cope with labor naturally? Is there a reward?
Yes, no.
Tell us more.
I think how your pain threshold is like
Thank you.
helps
Because there are
you.
some cultures, regardless of how the threshold is, you're not supposed to even cry during labor.
Sure.
You're not supposed to even scream during labor. You're supposed to show us that you're very strong, endure that labor so that you come out victorious, and that is how they call you a strong woman during the childbirth.
Sure.
And now the others who don't have that threshold.
Yeah. And now that even we have intermarriages,
Yeah, interreligious,
interreligious.
Yeah.
So somehow we are getting mixed.
or merged.
Yeah, and also science, people are learning more.
Yeah.
Because sometimes people maybe I'm not coping, but I don't have another way of dealing with my labor apart from coping, because there's nothing else that
You
is
have no
known.
option
You have no option.
than
You
to
don't know
cope.
than to cope,
You
yes.
just have to do it.
Yes, and you had to cope because your mother coped and your grandpa coped.
Yeah, because actually, most of the women when they come to deliver, they come with their mothers. Those who have mothers. It's because this mother had to go through exactly what this daughter of hers is going through, and it's a way of encouraging. If I did it, you can also do it. But now there's this, I will not call it a group, but there are some people whose thresholds are very low. And you find that they will not even cope with that labor, not unless you do something.
Sure.
Yeah, not unless you
But
do something
also,
about the pain.
By the change of our lifestyle, it has also made it a little bit hard.
Yeah.
Because a mother who has been farming,
Yeah.
doing all the exercise,
Yeah.
and somebody who is active,
Yeah.
they will not have the same type of labor with
Like
somebody
us.
who wakes up in the morning, goes and sits in the office.
Yeah, you are
Who has to
self-driven, you
purpose
got to sit in the office,
office.
you've not walked.
Yes.
Yeah.
So it's not by mistake, or it's not your will.
It is the times we are living.
It's the times we are living
Yeah,
in.
it is the
And
times
with
we
the
are
same
living.
thing with the times we are living in,
Yeah.
there are many ways now of coping with labor.
Yeah.
And I think, Evelyn, without wasting more time,
Yeah.
I think we should go just straight
to the point of how I can help myself during labor.
Yes. First, we'll
Yeah.
go through the natural ways
Yeah.
of coping with
The labor.
labor.
Now, the first thing about labor is if you want to cope with labor, just learn how to relax yourself. By learning how to relax yourself, I mean that you can, during a contraction, try and focus, breathe in and out. Mary, how does a pregnant mother who is in labor, how is she supposed to breathe in and out? I think there's a technique that you're supposed to know. You're supposed to breathe in and out during labor. One, to give your baby oxygen, to perfuse your muscles so that they relax faster. Yeah, so show us how a pregnant mother in labor should breathe.
Like during a contraction,
Yeah.
At the beginning of the contraction,
Yeah.
you feel the tightening.
Yeah.
As a mother who is pregnant, feels the tightening,
Yeah.
and then it goes becoming painful. So from the beginning, we take in oxygen through the mouth.
Yes.
Like
through the mouth or through the nose?
Through the nose,
Yeah.
and out through the mouth.
And out through the mouth. So in through the nose, and then you open your mouth outwardly, like that.
Yes.
Yeah, that is
deep but slow.
Exactly.
Yeah, so like.
Yes. But now remember, that slow, Mary, it will come.
It goes increasing
with the contraction, the way it
Yeah.
is tightening. I think that is well explained.
Yeah.
The second point will be?
Allow the mother to walk around.
Yes. Allow the mother to walk around. Okay, walking, what does it do? It helps the baby
Drop down,
because of
engage
the gravity,
further through the gravity.
Yeah.
And also, it also helps to, if the baby had taken a certain position,
Yeah.
the baby normally, maybe if I can just demonstrate
With baby Nana.
with baby Nana,
Yeah.
I can maybe stand,
Yeah.
look at baby Nana.
Yeah.
If normally the baby should come out this way,
Yeah.
facing my back.
Yeah.
If the baby is facing this way,
It's a difficult way, although they get delivered.
they deliver, but it takes time.
And it will be
and it is
painful.
very painful. Just to release this, as the mother walks,
Yeah.
this helps the baby to
dislodge where they are
sit
held.
yeah. And then it becomes a bit easy for the mother.
It's like a maneuver.
Yeah, exactly.
Like a maneuver.
Actually, it's a maneuver.
Yeah,
So that makes it easy for the
baby to come
baby to come down and also to take that internal rotation
for easy delivery.
for easy delivery.
Yeah. But there's a disclaimer I would want to give the mothers who are in labor. Labor is painful and it will continue being painful. Okay? I'm not saying we call it the occipital posterior position. We are not saying it is painful and the other positions are not painful.
They are all painful.
They are all painful. Although this one will be more
painful. And the pain comes more on the back.
Yeah.
It hurts more on the back.
Yeah, and it takes a while. It takes more time.
Sure. Another is also changing position even when lying down. Like if you're on the left,
Yeah.
it doesn't harm you lying on the left. It doesn't hurt to move to the right.
Yeah.
It's also a maneuver.
Exactly.
When walking, you can also try to do some locking.
Exactly. The change of position really
Change
helps.
of position. Like now, if we use this seat,
Yeah.
like this, yeah, you can see.
Yeah.
Even maybe you lock my.
You can see where I've held her.
Yeah. That way the baby is also able to rotate so easily.
Yeah.
And even does some small massages on my back.
Yeah. Just like that.
Another one.
Legs apart.
Legs apart.
Yeah.
We are still bedding.
Yeah.
With a contraction.
Yeah.
We do some deep breathing exercise, like we said.
Yeah. Then you go down, up, down. Mate, is it okay when we're with this position we use a ball?
We can use a ball, the same position, just maybe you bounce on it like this.
For those who can afford a ball,
For those
who
who
can access one.
Yes.
Yeah.
But if you can't,
It is still okay.
it's still okay. You
Yeah.
can do the squatting like the way you have seen us do.
Exactly.
Yeah, so you don't have you can't labor because you don't have a ball.
There's something I usually tell my clients, especially when they're in labor. Any position that you feel comfortable in, which will not hurt you, and it will not hurt the baby, it is still fine.
Very okay.
It is okay.
Actually, labor is self-guided.
Yes.
And it guides itself.
Yeah.
It tells you this is the most comfortable position.
For you at that
And that is why you
particular time.
find even some women
Yeah.
kneeling down. And they get down by themselves.
Exactly.
As long as the service is clean, it's very okay.
Do they even want to know if it's clean or not during that time?
Sure.
They don't want to know. Yeah. Because
So-
of that pain.
So that is the natural way of dealing with pain. You can also have someone to do some massage.
Yeah.
Like during a contraction, as you breathe,
Yeah.
someone is massaging your back.
Exactly.
Yeah, when the pain goes, anything that would make you relax.
Yeah.
This time you can be listening to
Music, your favorite music.
your favorite
You
music.
can use the favorite aroma in the room.
Yes,
Yeah, whatever you feel like it smells
it
good.
smells good to
It
you.
helps. Mary, do you think bringing a companion during pregnancy and during labor, to be specific, helps?
Well, yes, it helps a lot. Because you
It
see,
helps a lot.
anything that engages you
Yeah.
to stop thinking about
What
the
is
pain,
happening? Yeah.
it would really help. Because
Yeah.
this companion or the partner
Yes.
will come with you, rub your back. You see, you can't rub yourself.
You can't rub yourself. Yeah.
She'll remind you or he'll remind you on how to breathe. You'll take walks together.
Sometimes even
And
when
when
yeah.
and when the contraction goes, you can even have stories outside labor.
Labor is funny, guys.
Labor is so funny, guys. Labor is not constant.
Exactly.
It comes
gives you
and
breaks.
it gives you break. It comes and goes.
Yeah.
And during the break,
Yeah.
you can have stories of your childhood. That is why we always encourage you.
Yeah.
If you're going into labor, have someone that you've shared so much.
Is it necessarily your next of kin or your path? Okay, how do I say?
It doesn't have to be your
husband
spouse.
or your
It can be your mom,
someone very close.
somebody who is very close.
Someone whom you feel
You can
like
have a
never,
doula.
Exactly. or somebody you can't hide anything from.
Yeah, someone you can share so much.
Something you can, somebody who you will not even mind if she finds you in that
Position,
situation,
yeah.
and somebody who is you feel you're confident with,
Sure.
because that is your one of your most private time, and you need somebody who does not come there maybe to make jokes out of it.
Yeah.
Yeah.
But also, you don't need somebody who is going to empathize,
Yeah, you need somebody who is firm.
who will have empathy, not sympathize, rather.
Yeah.
Not somebody gets a contraction, oh, both of you cry.
Start crying.
No,
yeah.
you need someone who will feel you,
Yeah.
but at least be able to be strong for you
Exactly.
at the same time.
Yeah.
Another way, anything, as if you look at a way of coping, it is anything that keeps you relaxed.
Yeah.
Even if you take a shower,
A
warm bath,
yeah,
just let the warm water
run.
over your tummy,
Exactly.
especially during a contraction. It gives you such a great relief.
Yeah.
Anything that just makes you relax,
Yeah.
makes you move a great deal.
Yeah. Some patients, okay, some women some clients during pregnancy and labor feel that like movement is something like forbidden. No, you're supposed to move to the bath. Nothing has changed during labor. It is just that you are at that time of pain. Do what you feel like your body is calling for. Go to the shower, especially with guidance from your midwife, because it will reach a time when they'll tell you it is not time to go to the washroom.
To the
because
washroom,
baby
is near.
Following the instructions from the midwife, you do what your body is calling for, unless you are stopped.
You are stopped, yes.
Yeah, unless you're stopped. So having said that, there's a point we did not talk about. When all this is happening, we need to also stay calm. We need to also stay calm so that things flow well, because labor is a process. Although some of the mothers start labor and within an hour they are done.
Yeah.
But when you look at others, it is really a process.
Quite a number.
Quite a number. It's really a process.
Yeah, because like according to the books, from 0 to 4 centimeters can take up to 72 hours.
Exactly.
0 to 4 centimeters.
Yeah.
And from 4 centimeters to
full
10
dilatation,
to full
like
dilatation, another 6 to 12 hours.
Yeah.
6
so you
to
see, there's a lot of
time.
hours. And when you don't have a lot of encouragement, when you don't have enough support during that time, you might feel like you're left alone.
Another thing that really helps mothers is when they keep talking to their midwives, their care providers, so that you know where you are, what is expected of you,
what next,
and that is one of the things that help most mothers cope. If now we've tried all that, and the pain is not going, or we are not coping still, don't feel bad that you're not coping.
It is normal not to cope.
It's normal not to,
because there is pain involved.
Sure. So if you find we've done the bath, we've walked, we've changed position, then ask your midwife the next option.
For facilities who can
afford things like
pain management things. What do I call them? Methods
like painkillers. Now we can move maybe to something like the gas.
And before that, for you to know that a facility has the methods of pain, what are they supposed to do?
If you remember, guys, if you watched our previous videos, there's one video we did,
the tour,
the hospital tour. The importance of the hospital tour. This is where you go and inquire what pain management options do they offer, so that you see whether this is the institution that fits you.
Because some come with a cost implication, some come with a different doctor involved,
some some may not be available in the facility that you are going to. So it's always good, now that you have known which are the options,
it is good to
now
understand.
go when you are shopping for the hospital, ask for the options, what they have, so that by the time you go there, you are aware.
Exactly.
Yes.
Now at this particular time I went for my tour and I found that the hospital I am is offering the gas you talked about. Tell us more about that.
So there is this gas we call the Entonox gas.
The Entonox gas.
The laughing gas.
Laughing gas is also called the nitrous
oxide.
Yeah.
It's available here in Kenya.
Most love that thing.
Yeah, many love it because it is easy to use.
It's easy to use.
And it
makes
cheap.
You feel good.
Yeah. So just find out, is it available in this institution? Now that you have known we have the laughing
gas.
And how does it work, Evelyn? The laughing gas.
The laughing gas comes in a cylinder.
Just like the way oxygen comes.
Just like the way oxygen comes. And then there's a special tubing that will bring the gas to the person using it. Then there's a special mask that will help the client breathe in and out at the beginning of a contraction. You breathe in, it gets in.
So for you to use the Entonox gas, you must be able to do the deep breathing exercises during the contractions.
Because you must be ready to do it.
You must be ready to do it.
Yes.
Yeah. Like we use it during a contraction.
Yes.
And you must, it's how much you deep breathe, it's how much you get.
Exactly.
Like you inhale and exhale through the same tubing.
Yeah.
You get enough gas that makes you feel quite relaxed, a bit high.
Yeah, you'll feel good.
Dizziness, and you feel good. You tend to forget about the next contractions. And most clients are able to take a nap in between the contractions.
Yeah, you know, actually the more you inhale it, the more high you get, and the more numb, I would call it numb, the contraction gets. You will feel the contraction, yes, but compared to how it was during the time you were not taking the Entonox, it is totally different. Now, something else, Mary. Is it okay if I breathe the nitrous oxide? Is it safe for me and my baby?
It's very safe. Because we only do it during a contraction.
Yeah.
And it lasts for about 20 seconds in your body. And then
it is
so the continuous use is what gives you the continuous benefit. Yeah.
So that's it. As we've heard about that, it is safe for us and the baby. Any side effects?
Apart from feeling high, dizziness,
which is okay with the feeling.
Yeah, you feel like you are high.
You feel sleepy.
You are sleepy.
Yeah.
Now the sleepy part is also what helps you to get to the next contraction without remembering the previous one.
Exactly.
Yeah.
So guys, that's it about the laughing gas. It is effective. It is effective. For the people who have used the Entonox gas, that is the laughing gas, can really testify that it is
effective.
It is effective. I know why you're laughing. Okay, now the nitrous gas has not worked.
Okay.
What do I do?
If the nitrous gas is not working, you can still have injectables. Injectables, that is injectable medication, what we call opioids.
Yeah.
We have the pethidine,
which is a narcotic.
Which is a narcotic.
Yeah.
But
safe.
Very safe.
Yeah, with the pregnancy.
But given with some
caution
and guidance.
Exactly.
Don't go with a very fixated mind.
Yeah.
Me, I want to do Entonox after Entonox. So the care provider can decide.
Yeah.
For you, Entonox may not work for you.
Exactly.
We move to the narcotic. So you work hand in hand with your care provider.
Yeah, remember we said for Entonox, you have to be ready. Now, if I give you the Entonox and you're not able to breathe, then it will not help
It
you.
will not help.
I will go to the next way of helping you during the pain, and which is the injectables. Yeah. As Mary had said, the opioids, then you are injected.
Yeah.
Given with caution and guidance.
Given with caution and guidance.
Yeah.
Like opioid, you can only get up to that when you're so near to the delivery.
We can't give.
You can't get. Most hospitals, they'll tell you from 7 centimeter and above.
You can't get the
You can't
opioid.
get because it can affect the breathing system of the newborn baby.
Yeah.
Yes. So you find like the baby comes out also sleepy like you.
Exactly.
So having trouble to breathe.
Yeah. And it is not good for, okay, you know that once you've delivered, the baby will get affected by that drug. So you can't give after 7 centimeters.
Yeah, so we try to avoid them from 7 centimeter.
Yeah.
The good thing about it, it takes like almost 70% of the pain.
Exactly.
The gas, the natural, nothing takes the pain away completely.
Yeah.
It just makes us comfortable to a certain level.
Yeah.
Like if you are getting at a full blast pain, which is maybe 100%, now it reduces to about 40-50%.
Exactly.
So that you are able to cope.
The contraction will still be there, but you will be able to cope with them much better than when you didn't have the injection on board. One thing about the injection, Mary, we should know that in case sometimes people are given the injection and they deliver very fast. It's no one's fault at that moment because one, I didn't know, I might give you the injection when you are 4
centimeters.
Just
relax and everything
works out for good. Then the baby comes within an hour. That has happened and it is no one's fault. Then the baby comes out asleep. There's a way to deal with that.
And not necessarily all the babies to come out asleep.
Yeah.
It's just in some instances.
Yeah.
Yeah.
Yeah, so what has the opioids do? I can say that one of the things that I would say does bad, it's like it interferes. It's a negative. It interferes with the first hours of the baby and the mother.
Yeah.
Which are most crucial because if a baby is delivered within 1 hour, 1 hour they're supposed to be put on the breast. But if the mother was given this injection, the drug is still on board until that time. Then she falls asleep, baby is asleep. You see, the first hour is interfered with. So the bonding and the feeding are interfered with.
Yeah.
That is the only negative, I think. Is there not, unless there is any additive, Mary?
No.
So after that,
now
I still feel pain.
You're still not coping?
Even with your injection, I'm still not coping. So what next?
The next option, we can have epidural.
Yeah.
Epidural is a local anesthesia that localizes the nerve that sets the birth canal nerves that sets the pain impulses to the brain.
Exactly.
It's localized. So, like it stops sending those signals to the brain.
Like they block?
Completely. No pain during labor. Read magazines.
Yeah.
Once you get that one, watch movie.
While you're contracting.
While you're contracting and you can't feel.
Yeah, that is epidural anesthesia.
Yeah. The only thing with epidural, you require a specialized personnel.
Yeah.
That is another test. It is not given by any other person.
Yeah.
Like these other ones.
Yeah.
All of them can be administered by a midwife on duty, can be given by any doctor.
But for this one,
for this specific one, this must be a specialist.
Yeah.
It has its own cost implication.
Yeah.
It's expensive.
Yeah.
So that is why we are saying when you go for that clinic, kindly
ask
which pain management options
do you offer?
Yeah. And if you know you will need an epidural, always organize before admission. Even you can organize to meet the anesthesiologist who will offer to give you the
epidural anesthesia.
Just to have a walkover.
Exactly, about
learn
it.
about it.
Yeah.
Expectation of it.
Exactly. Mary, are you trying to tell me that when I come to the hospital, I need to be open-minded because one, I don't know whether I will cope with the first natural. I don't know whether I'll cope with my injectables. I don't know whether I'll cope with my Entonox. So I should come open for any method that will work for me.
Sure. As long as your pocket
is friendly.
It's friendly because epidural is a bit expensive than any other. Mode of pain control.
Management, yeah.
And they don't have to follow in order like the way we have explained them.
Sorry, yeah.
You can come once you are in active phase, have your epidural. You don't have to go gas and
and for epidural, because it's something that is invasive and it is invasive on the back. Have you told us how it works? There's an injection. Though will come, it is a video on its own. Would like to give you the information about epidural.
We would like to have an anesthesiologist with us. Actually, we have one. He's willing to come and discuss the
whole process.
The whole process, the do's, the don'ts, the benefits. And then you can make a well-informed choice.
Exactly.
And since it's an invasive procedure,
it will need a consent.
You have to sign a consent.
This is not to scare you, but you need to sign a consent.
But now when he comes on board, guys, you will have all the time to ask all the questions. I don't know whether we'll do it live or how do you like it, guys?
We can go live.
We can go live so that you can ask as many questions when he's still on board, and then he can give you all the answers. Let's see. Do a comment on our...
please comment below so that we can understand what people really want about it. Because I know most people didn't know about the epidural anesthesia earlier on, but now it's becoming very common
and very popular.
And most people they fear. There's a fear in epidural, and we want to clear that because it really helps during labor. It takes your pain away completely. You deliver with no pain. It is a good thing. For as long as it is done well, the precautions have been taken. All that we want to put in black and white when the anesthesiologists come. Okay. But remember, during epidural, something to tell to inform you. Epidural does not make you feel drowsy. Because before we bring the anesthesiologist, somebody might require to do the epidural.
It is good to know that. So epidural
doesn't cause
any drowsiness. Epidural just leaves you. It just numbs below the navel. Your legs become numb.
And some people walk with epidural also.
So there's what we call a walking epidural. And lately, Evelyn, lately we are having water bath.
Exactly.
Whereby you enter, that's another mode
of pain control.
Not bathing, it's called water bath.
So I just sit in a pool.
Just sit in a pool.
Or a bathtub.
Or a bathtub full of water. Below 37.5 degrees. And you bath from there. And that makes your body relax.
Actually, the main point here is to relax your body muscles.
To relax your body muscles.
And you have relaxed, your cervix also does what?
Relax and opens and the baby
walks out.
So guys, don't agree to suffer.
Nowadays is pain. Pain must be controlled.
Let's get use of science.
Technology.
Let us embrace technology. We are still on midwiferealityshow.ke.
Bringing you the best.
So guys, let us know what you do in your
area, where you're watching us from.
So that we know how you take care of your mothers. We know how you are taken care of. What you would wish to be done to you.
Yes, so having said that, I think we've covered the pain management.
Sure.
Not unless the viewers would want to add, please add in the comment section. Would really love to read from you people. Yes.
Thank
Until
you.
the next one.
Bye.